So we've experienced that. When you have an outside third party that's inserted into the process, and we have to depend on their processes as well as their timely dispensing and delivery of an oral agent for our patient care, we've experienced delays, and they're not rare, which puts off the start of therapy for our patients. Sometimes we have to start infusion therapy without the oral drug, not the way they were meant to be given. Again, to have control over the timely delivery, and for the patient, sometimes it is critically important that they get started as soon as possible, depending on their cancer, depending on how symptomatic it is. But even without that, just being diagnosed with cancer or a progression of their cancer dictating a change of therapy, it's a time of anxiety, instability, a time of facing your mortality. And to get them back on their journey, the first path, or maybe it's a second line of therapy, is really important in terms of securing them as they go forward in their care. And there's other elements, to the processes of prior authorization, formulary restrictions, perhaps, things that add layers of time, complexity, in trying to advocate and get the therapy you need, and it adds extra cost on the resources you need to do to manage that. So when we are doing it at the practice level, we're immediately starting these processes. We're doing it. We have financial counselors who are critical to starting the prior authorization process, vetting the prescription coverage, knowing if there's copay burdens, gaps that need to be filled and supported. And they are doing they're part of the patient care relationship. And I mentioned this in the session, the greatest testament that we saw to even their role. We had a patient who had passed away, and in the obituary, they particularly noted our financial counselor in deep gratitude for all they did for their care. That's unusual and value.